Hello, America.
I'm Danita.
I'm Nadine, and we are the Bruna twins.
And we are hot.
Yeah, and we know it.
I love my body the way it looks right now, but I really want to fix my symastia.
We work out every day, lifting weights. Still, my arms don't look the way I wish.
We start with modeling with 22 years old. Together we have 1.5 million followers in social media.
For sure, people follow us because we are sexy.
Pretty good job, yeah, I'm pretty happy. But our job is not post picture, it's keep the body, you know. People think, oh, your work is so easy, it's not.
We were born in Buenos Aires, Argentina.
When we were teenagers, we grow up without boobs, like a boy, nothing. I save dollar by dollar for do it.
I love plastic surgeries. I love everything about vanity, aesthetic, and beauty.
I think plastic surgery makes people happy. Curves is power. You get whatever you want with curves. After my first surgery, I had symastia, had a uniboob, and was so embarrassing, and I had 5 surgeries. But it wasn't enough. I still have the problem.
Growing up, I was fatty and with big booty. And then I lost like 35 pounds.
Yeah, it was huge.
So I had a lot of extra skin, and I had the mini arm lift, and I did it 4 years ago in Argentina. I went to see the doctor because in these 4 years I became more fitness, so I have more extra skin. Made me very frustrated, work out so much hard, and I still have that problem.
We are super excited to meet the Dr. Nassif and Dr. Dubrow because they are great.
And they fix everything.
You can help me with my spray tan?
Yeah.
Okay. We are preparing for a new photo shoot in LA. So we've been working hard the whole week, doing diet, and today we have to do the spray tan for look good.
I can still see your problem.
Look at this.
If you push, I can see it.
Yeah, look at this.
It's bad.
So bad. Oh my gosh. I do a lot photo shoot in bikini, and I can't use all because if I use some push-up, my symastia come out and I feel very insecure and I hate it. For real, I hate it.
Well, some like me, I hate this. No,
Yeah,
it's a lot of
pretty
skin.
bad. I don't know what you can do.
I work out so much hard, arms, shoulders, triceps. No matter what, my skin is still there. I'm very excited to see the doctors because I know they can fix my problem.
Thank you.
You're welcome.
I feel ready.
So we have 2 new patients together. We have twins. Just like I have twins and you have twins, we have a pair of
Identical
twins.
or fraternal, do you know?
I actually don't know. Let me show you what they look like. Come here.
Those aren't real butts, are they?
That's a huge butt.
That's a huge butt.
Ah, okay, so there's an incision under the arm. So this one's had a limited incision brachioplasty for sure.
Symastia.
Oh, she's got a symastia, huh? Oh, yeah. So let's bring them in. There may be something we can do for this and help her.
Please send in Dana and Nadia.
Hello.
Hello.
How are you?
Hi, doctor. How are you? My name is Nadia.
Nadia.
Hi, Nadia.
Hi.
Dubrow.
Nice to meet
Nice
you.
to meet you.
Dana.
I can tell they have a lot of energy, they are really fit, and they've had a lot of work done. We have to ask you the magic question. Your butts,
Yes.
are they natural?
8 months ago, we did a fat transfer.
Where'd you get
in
fat?
Colombia. We had to gain weight.
Yeah.
Like 6 pounds.
Couple pounds.
And how many cc's in each buttock?
Must be at least 300.
Yeah, I think because
I
it's
don't
pretty
know.
big.
The Bruno twins had probably the largest fat transfer buttock augmentation I've ever seen. No facial surgery?
No, Botox, lips, and teeth.
How many breast surgeries have you guys had?
Until
3.
now, 3.
And I had 5 because
5.
my first surgery, I had symastia.
Your first one you
Yeah,
suffered?
it was
Yeah.
really?
terrible for
18.
me, terrible.
So how many cc's did they put in at first?
And 290?
You had symastia with 290
Yeah.
cc implants?
So the
Yes.
dissection must have been horrible.
The fact that a symastia occurred with only a 290 cc implant unfortunately indicates that it was probably just a poorly done procedure. Let me ask you a question. So what exactly are your goals?
Well, I was fat, really fat, so I lost like 35 pounds.
35.
Yeah,
Okay.
and I did 2 liftings.
Liftings.
Lifting.
What-
Yeah,
what is the
lift
invo-
arm. I did. So I wanted to do another lift, arm lift.
Okay, so you want to tighten your arm skin.
Yeah.
And what's
And
your
I won't
situation?
fix my synmastia. All the time I'm concerned about how my breast looks, and I think that can show in the camera, you know? So I hope fix it.
You both have problems that have well-known surgical solutions that can work, okay?
Yeah.
The question is, at what cost, and are you really appropriate candidates for them? So why don't we go examine you and see what the options are to see whether that works for you, okay?
Okay, perfect.
All right, let's go.
Thank you, doctor. We love food more
We
than
love
you guys.
food. We
believe
love
me.
it.
Trust
We
me,
love food.
you do not love food more than this guy.
I can tell.
Wait a minute, hold on. I'm not fat.
Do me a favor, put your hands on your hips and push. Okay. So you're actually very soft. You're not encapsulated, so that's very good news. I think the attempts at repairing your synmastia have been done using old surgical techniques. And there's new surgical techniques that are really effective, okay? However, you would just have to allow one thing to happen, and that is a very significant downsizing of your implants, like half the size, to allow that new room to heal, right?
This gives me a lot of work, like for calendar, magazine, you know, I need a big breast.
Okay.
It doesn't.
The treatment comes at a cost, and the cost you're not willing to pay, and that is going smaller.
I don't feel happy, of course, because I was hope to fix my problem, but if I go smaller in my size, I will lose many work.
So I think the solution right now is no solution, right? Don't you agree? I think you're in a good place.
Okay. Thank you.
Now, okay, so you had loose skin on your arms.
Yeah.
And you had what's called a limited incision brachioplasty.
Yeah.
Can you turn around? Take a look at these scars. All the way back here.
Right. So you not only have a scar that extends past what we call the posterior axillary crease, right? It's also bunched up. This is called a dog ear. Dog ears are excess skin at the ends of the wounds, which look like they're sort of hanging as if they're sort of ears on a dog. You have had some significant liposuction here, so now the skin's sort of a little thin, and that's one of the reasons you have laxity. But I will tell you, there is an operation you could do to take it to the next level, which is a cut that goes from your armpit all the way down to your elbow. Is that really something you want to do? Do you really want to trade a scar to give you a what, 10% improvement?
For sure, no.
Right.
No, it's no. I want to have perfect arms, but I don't willing to do some surgery that give me a lot of scar.
You both are beautiful. The last thing you want to do, and you're really young, is to have that long scar underneath your arm.
Yeah, you're right.
Not a good option.
We feel very confident right now, and we will try to do our best the way we are. We think we don't need surgeries, so they are right.
But you know what? You inspire both of us, because we've been working so hard the last several months that we haven't been working out. And seeing you makes me want to exercise again.
We love food more
We
than
love
you guys.
food.
Believe
We love
me.
it.
Trust
We
me,
love food.
you do not love food more than this guy.
I can tell.
Wait a minute, hold on. I'm not fat. Hold on, you're saying I'm fat?
We like fatty guys. Don't worry, we like.
Yeah.
Chubby chasers,
He's
you're
lying,
in!
he's
You're
lying.
so in!
I'm Lucy. I'm Anna. And we're the world's most identical twins. We eat the same, sleep the same, talk the same, but unfortunately, these aren't the same. We grew up in Perth, Western Australia. Our mum dressed us up the same from an early age. We didn't want to dress differently. We had the same friends, we're in the same classes. We share everything, literally, from a job, a car, a Facebook account, a mobile phone, and even a boyfriend.
Can I start you off with something to drink, or?
We would just want orange juice, but can you make sure they're exactly the same? Like maybe level it.
Sure.
We have been eating the exact same thing, the same size quantity of our foods for about 10 years now.
That one's still got more.
Because I want my body to look like hers, she wants her body to look like mine. We don't want to weigh differently.
That one's still got more. No, it's not. No, that one's still got more. That one's still got more.
Growing up with flat-chested, A, completely nothing. So we found our plastic surgeon through the yellow pages. We didn't really research, which we should have. We just wanted breasts. Waking up from surgery, we looked at our breasts and we're like, I just don't think they're identical. We have a long scar which is very visible under the breast. We both do, very long. A gap in the middle, a large gap, which I wish they could fill up. I feel as though she's got a little bit more tissue than I have, like just a bit bigger. Yes. We've gone to so many people in Perth that have said no to us, closed the door. We've just had enough. We won't be happy until our breasts are identical. These doctors have to help us.
Welcome to Kyle Bailey too. If you need any help today, just let me know. I'm Mariana.
Thanks so much. Sure. We think the same, like we'll go into a closed store, she'll know exactly what items I want.
This one. Yeah, this is nice.
Yes,
this is nice. We need more red, I think.
Yeah, we need bright colours.
We need
stand out.
Yeah, what size is that?
It's a medium.
Yeah, same. We'll get a...
Our clothes, we wear once and never wear it again. So. The reason for that, I think we don't feel good the second time round. We're hoping Dr. Dubrow and Dr. Nassif can help us with our scars and making us more identical. It's not tight enough. What do you think of this dress?
It's just too long.
What do you think?
I like the colour.
I don't know if it suits us.
Let's go.
We actually have twins, okay? Anna and Lucy. They have concerns about their breasts, okay?
Can you please send in Lucy and Anna? Hello.
Hello, lovely to meet you, Lucy.
Lucy.
Anna.
Anna, Dr. Nassif.
Hi, Lucy.
Hello,
Terry Dubrow.
Lucy. Hello, nice to meet you. Anna,
Anna, pleasure.
We're the twins.
Really?
We chose Dr. Dubrow and Dr. Nassif because they're the best in the business. Like, best in the business.
I have identical twins.
Oh, lovely.
I do.
Boys or girls?
Boys. And they are like best friends and everything. They do everything
We
together.
do everything. We're 1 minute
Fall
apart.
asleep, same time, wake up
We
at the
do
same time, everything.
together. We literally share everything from my car, job, even a boyfriend.
Even a boyfriend.
Kidding me.
Yeah,
No.
we share a boyfriend.
You share a boyfriend?
Yeah.
Yes.
Right?
It's like we live as one person.
We've even
Really?
been the world's most identical twins.
That's weird. One day you're gonna get married and have kids maybe, right?
Maybe no to the same man.
Not to the same man.
Yes,
to the same
You wanna
man.
marry the same man.
If I got pregnant,
I would have to get pregnant straight away.
We would make sure that happens.
Definitely.
Like
straight away.
Straight away.
Straight away.
Yeah.
And maybe this is probably not, I gotta figure out how to say this properly, but is it like simultaneous? Like when you guys are all doing certain
We're
things?
all together in the bed, but I don't do anything with my sister.
we don't.
No.
It's all with him.
Yes.
Right,
He
right.
gets everything.
Yes.
So
Right.
you guys just,
So,
essentially, so it doesn't feel weird that there's
no
sex
jealousy.
going on with the other one watching her.
If he kisses Anna, he'll kiss me straight away.
He knows to
He
do
knows
that.
to do that. There's never
So you
any
trained him
jealousy.
appropriately.
Yeah, we've trained him.
so he's like a keyboardist.
Yeah.
Who
But
has
we ne-
two
yeah.
keyboards, like he's playing
Yeah.
both at the same time.
Yeah.
I understand them wanting to eat together, sleep together, share the same boyfriend together, get pregnant together, exercise together. Yeah, no, I don't understand it.
We've only had our breasts done. That was like 7 years
You
ago.
haven't done the same day?
Oh, yes,
of course.
Who
I
went
went
first?
first, and then I did.
Yeah.
We're very unhappy with the scars as
scarring.
well, and we feel as though they're not identical. The breasts,
I
mine
feel-
don't look like hers.
I
Hers-
feel
as though she's got a bit more tissue. Like her breasts have always been a bit bigger than mine.
Everything else is identical, but the
except
breast.
our breasts.
Normally we talk about symmetry with breasts, try to make the right and the left even.
Yes.
But
Yes.
I don't really think we've ever talked about making a pair identical to another pair. It's more about getting the two as even as possible.
Exactly.
Let's go to the exam room. We're gonna have you change.
Yeah.
And then we'll take a peek and then give you our advice from that point.
Good.
Okay.
These girls have traveled all the way from Western Australia to see whether we can improve the identicalness between them. Their story is weird, but we owe it to them to hear them out.
Thank you
Thanks
so much.
so much.
Thank you.
Wait a minute, Lucy.
Yes.
Thank you very much.
They're not identical.
Both of you are similar in terms of being identical twins, but you have fundamental differences. Your eyes are wider, your eyes are more narrow. Have you noticed this? Don't you agree?
No.
Your noses are different, right? Your chin is more recessed than your chin. Your chin is more prominent. Your clavicle goes straight across, yours goes up like this. You are identical twins, but you're not perfectly identical. If you go substantially bigger, the differences will become more apparent. They will become more exaggerated. This depth will look more deep the larger you go relative to the depth here. This distance will look longer in you than you. Trying to achieve perfect symmetry between two people is not at all possible because you can't even achieve symmetry within one person. So it's just an unrealistic goal that Lucy and Anna have. Right now, you both have really pretty breasts. You do not have complications. You have fantastic results. You have pretty good symmetry. It's not as symmetrical as all the other things in your life, but I think you guys should think very carefully about trying to improve the symmetry between the two of you, because I predict very strongly it will make you more
Different. More different. Yeah, what are you saying? We'll make it more different. Like they're not going to be identical. Would be more different. Yeah, would be more different. We don't like that. No, we don't like that.
Complications can make things worse too.
A small portion of me thinks that they're going to go back to Australia and have somebody do larger breast implants. I really hope that Anna and Lucy listen to our advice.
Do you think you're going to follow this advice, or are you going to think about it?
We'll definitely think about it. Maybe we shouldn't do what we're going to do. Maybe we should just leave it because we'll be exactly the same more if we had them not done. But never say never.
Nice to meet you guys.
So nice to meet you. Thank you for your time and advice.
I'm Carissa Shannon. And I'm Christina Shannon. And we're the Shannon twins. And we're here to get our botched boobs and nose fixed. We're best known for the Girls Next Door show on E! And we're Playboy Playmates, Miss July and Miss August 2009. First double issue of Playboy. And we dated the boss, Hugh Hefner. We came from a poor Italian family, a small town in Florida. We both grew up in an abusive home. All we've had is each other. Our grandmother raised us because our mother and father were very young. We call her mom since we were babies. She let us do what we want. We set our own ground rules for ourselves. So we just have these wild, spunky personalities because we really didn't have any guidelines. And then when we turned 18, we flew out to the Playboy Mansion. Naughty. And we became playmates, and Hef wanted us to move in and be his girlfriend. Dating Hef comes with a lot of responsibility. Moving into the Playboy Mansion, we're thinking no rules, no boundaries. It's gonna be bigger, it's gonna be better. Parties, huge lifestyle, fun. And then we started getting in trouble for a lot of the stuff we were doing. We were breaking the rules, which was normal at the age we were. We're here today to do a photo shoot. We're supposed to be identical twins, and we don't look alike anymore because of the surgery. And we're supposed to be known for perfection for our boobs. Yeah, we're like Playboy Playmates. They're casting, hot twins, busty boobs, whatever. Tell them how you got botched. We got criticized a lot about our noses, about how small our boobs were. We felt like flat-chested little twin boys when we arrived to the Playboy Mansion. That sums it up, yeah. We felt intimidated and we wanted to fit in. We were like thrown into the spotlight and judged by everybody at such a young age. It made us self-conscious, and that's something that we never were used to feeling. So we decided we needed our noses and our boobs done. So we were sent to the clone machine. We're like clones. We get in, we get platinumized. It's like the same salon, same surgeons, same everything. So we went in and they got like pumpkin carved out, let's just say that. Our noses are way too pinched, too small. It's too fake. It looks too fake. They were f***ed up. When you have a bad surgery, it gets worse as you get older. Like we had no cartilage left in our noses. The boob jobs came after the noses. We've had 5 boob jobs by the same doctor. Damn, he made some money off us. Oh yeah. We did Playboy at an A cup. After 2 years of living at the Playboy Mansion, we went to a double D. She got her boobs done first, she went small, and then I went to go get mine done, and both of our boobs got botched. I think we were botched because we were young 18-year-old girls and they threw huge implants in there and just stretched us out. These doctors have been working on a lot of these girls for so long. They're stuck in some type of time. Surgery changes and it's modern day now, and the look changes and the style changes. It looks too fake and we just really want to go back to our natural look. After all said and done, we've spent over $80,000. Way over $80,000. Okay, we're like cars. We're like Ferraris. We're really expensive. We've spent a lot of money on putting parts on. We're valuable. We've invested into ourselves. Seriously, we need to get insured. It's affected our career a lot. We haven't been taken seriously. We want to be taken seriously, so we want to fix everything.
Why can't you do a nude photo shoot?
Because the scarring is so bad, and one of her boobs are so much lower than the other one when she has, when she's just bare. We haven't been able to do much nudity. We've been doing everything covered up, lingerie, but we want to get naked. We want to push the buttons. So we're excited for these surgeries so we can get naked and do a hot, sexy twin ass nude photo shoot. And we want to look more alike. Yeah, we do. We love each other. I think we do. Maybe a little kiss on the cheek, you know.
Can I ask you a question?
You're going to ask me anyway. What is it?
When we were in your office and you walked up to me and announced, I'm going to fuss. And I thought, fuss?
I wasn't even by you.
I thought, fuss? Make a fuss? Something upsetting you? And then all of a sudden, wafting stink everywhere. And I realized fuss means fart. What language does fuss mean fart?
First of all, it's fuss, and it's Lebanese.
Lebanese.
But yes, I
look
did
me
not.
in the eye.
I did not.
Are you telling me that didn't happen? And then you had the gall, as I evacuate the area, I put 10 yards of safety between me and your fumes. You walk over to me. Can we just hold a moratorium on farting just for today? Please fuss outside, fuss in your car, fuss in the bathroom, but don't fuss around me, please.
It's fuss.
Good morning, doctors. Carissa and Christina.
Carissa.
Nice to meet you,
Hi.
Dr.
Jerry
Nassif.
Dubrow, nice to meet you.
Today will be really good because we're going to find out what Dr. Dubrow and Dr. Nassif can do to fix us, if they can fix us.
Who's older?
Me.
You're 1 minute older.
2 minutes older.
2 minutes older. So it's because you're older, is there a little difference between you two?
Yeah, I'm obviously wiser, you know. She started Botox 2 minutes before me. She started the fillers first, too. You did the boobs
Fillers,
first.
Botox, and you're 25.
Yeah.
The twins are beautiful. 25 is too young to have that much work done.
What was your first cosmetic experience?
I had my boobs done at 20.
And then how long after did you do your breasts?
21. She tried to one-up me. I went to a B cup and then she went one-up on me when she did them and went to a C. I've had 3 boob jobs. It's hard to keep up.
3.
Yeah.
And how many have you had?
2. The next one I went to a double D.
Wow.
And it
is that what you
literally-
wanted?
No, I didn't want this. I just wanted to look like her. Not only that, but he did a Benelli lift to make my areolas smaller, but and actually made them bigger.
Right, because he
Because
blew
they're
up
bigger,
the
yeah.
breasts and then
Yeah.
did a tightening of the areola. That's not going to
Yeah.
work. So you have a wide scar around your areola.
Big, wide scar. Have the wide scar.
Did you have a lift also around your areola?
Yes, she did.
So what size do you think you want to
What
be?
do you think's perf? Because you're the
I mean,
boob dog.
to be honest with you, it's up to you for sure, but I would consider staying in the D range.
You're a boob man.
I like
That's
boobs.
what it is.
You know, I like big breasts. I'm not gonna lie. In my professional opinion, the Shannon twins, they're playmates. They want big boobs. That's what their whole thing is.
Now, let's talk about the noses. When was the last time you had fillers in your nose?
It's been 6 to 9 months.
So you probably have fillers still in there because filler
Yeah,
lasts
yeah,
a lot longer
for
than the
sure.
nose.
You can't
so you
even
have
see
some
it.
filler.
Yeah.
So I think what we're going to do now is we're going to bring you in the exam room. Okay, let's go.
This is my calling in life. I was born to help playmates restore their breasts back to normal. Raise your arms up. Okay, now your arms down for a second. This right breast is lower than the left, right? What we need to do is take the implants out, downsize them, and do a lift around the areola because you already have lift scars, so I can use those. And I'm gonna use a special suture material that will prevent these areolas from dilating up again. That's kind of,
But let me just take a peek.
Way back.
So your breathing is worse on your left. I'm going to touch inside your nose to see if there's any cartilage. And there's not. Okay. Okay, how about now?
Oh, way better.
Yeah.
Chris's nose is an over-resected nose. almost all of the cartilage has been removed. So my goal basically is to actually just reconstruct it and also get it functional. Let's have you two switch.
Oh crap, okay. It's like ours is the total opposite here.
Okay, now let's see.
Let's
Hair back.
Take your hair.
Wow, this one, your left is lower than your right.
Really?
And this one is soft and this one is firm. So this is encapsulated. This is the most common complication of breast augmentation surgery, where scar tissue forms around the implant. And it's caused the implant to be tight on your chest wall, which gives you pain.
Yeah, it's painful just to go like that.
Yeah. What we basically have to do is sort of the opposite. Rather than tightening up the pocket, like I have to do on your sister, I have to open up the pocket and remove some scar tissue on this side, okay? But we have to reduce both implants, reduce both areolas. Yeah. It's almost bread loafing. I'm gonna see if I can improve that too.
I'm just thinking your sex life. Possible. Just talking about your sex life. Sorry. I'm sick of these melons. I'm gonna take my implants out and give them to Pamela Anderson. I'm gonna sell mine on eBay.
Let me take a peek inside you.
Okay.
I'm gonna take that Q-tip again. Yeah, your breathing is a lot better than your sister's. Same thing. Both Carissa and Christina can't stand that overdone nose look. So they both have had fillers placed in the nose to make it look more natural. And they both want a functional, natural appearing nose. Same situation. I need a piece of cartilage. Take out a little piece of rib. He goes back into his breast, then I come back into your nose.
Same day?
Same time, same surgery.
Oh, cool.
You know, do you have any more questions for us?
No, that's it for me.
You guys comfortable with this?
I'm trusting and exciting right now. I just want to do it. I'm excited.
Okay.
So let's do it then. This will be great.
Yeah.
All right, good.
Here we go.
Great meeting you guys, a lot of fun.
Thank you so much.
Christina.
Yes.
Got it. Okay,
Thank
great.
After being double teamed by the doctors, we'll definitely be ready for our nude shoot. Tits out and everything. Oh yeah, bearing it all. Hi. We're checking in for surgery. Today's surgery day. I'm super excited. She's up first. I want our noses to match. I'm freaked out.
Good morning, ladies.
Hi.
Doctor's ready for you.
Oh,
Take you back,
Here
all right?
we go, Carissa. Okay. I think that Carissa wants her nose to look a lot like mine. I do. I don't want to look like Cindy Lou Who.
When we operate on someone who has a side, like a right side or left side, we mark that side. It's actually a requirement, okay?
Oh, okay.
I'm gonna write it on your forehead,
Go
all right?
ahead. Just write it across my forehead. I really,
So that we
honestly.
don't make... Did I spell it right?
Yes. Is he spelling mine
I think you're a
right?
nut. So that's interesting.
Okay, did I do it right? Paul and I need to do a tag team on the Shannon twins so that we can give them the results they want. Let's do this. This could be good.
Now, let's go.
This can be like a relay because first I'm gonna go in and take rib from Carissa. Then Terry's gonna come in and start her breasts.
So with her breasts, they fall off into their armpits. The most difficult part about that is sewing off the corners of the pockets to centralize them.
Yeah.
First, Paul will remove Carissa's rib cartilage. He'll then perform a septoplasty to straighten her septum and using the rib cartilage, give her a functional and natural looking nose. I will then remove Carissa's implants and using a procedure called a capsulorrhaphy, I will stitch up the sides of her breast pocket, which will tighten and centralize them. Then using the Benelli donut technique, I'll cut around the areola, making them smaller and remove her scarring while simultaneously doing a lift. I'll stitch her up using PTFE graft material, which will prevent the scar from widening.
They both have duplicate noses that have been overdone.
For me, Christina doesn't need the pockets made smaller. In fact, they need to be made slightly bigger because they're a little tight. First, Paul will remove her rib and use it to build out Christina's nose, straightening and widening the bridge and nostrils in order to give her a more natural shape. Then I will remove Christina's implants and expand her breast pockets. Next, I will use a Benelli lift, cutting around the areolas, removing the current scars, and shrinking their overall size. Finally, I will close the incisions using PTFE graft material, which will prevent the scar from stretching.
Our surgical relay is about to happen for the Shannon twins.
All right.
So let's get this done.
All right.
Hi. We're here for Dr. Nassif and Dr. Dubrow.
And sign in.
Check me in anyway. This is our first day out of surgery and it's the most difficult. We feel very sick and very sore. Everything's itchy because it's healing. I look horrific. Or is it horrendous? And nobody can understand what we're saying. I look like I got jumped by the Pussycat Dolls. I can't even smile. Everything feels like swollen and out of place. Like it's like a unicorn without my horn. Just as she explained it. And that's fucked up.
How are our favorite twins feeling?
Good.
How are you, my loves?
I am completely out of it. Lots of pain medication. We're not meeting. It comes along with surgery. It's not recommended, but it helps. It takes as needed.
You just had your surgery. How are you guys doing?
I took a look at my boobs. I freaking love them.
You took my dressing off?
Yeah.
I should have known these girls couldn't follow simple directions. They're identical twins. They're two completely separate girls, but I suspect they share one brain. Okay, let's just take this off. Whoa.
Oh, you don't like it?
Wow.
They look great.
All right, I'm gonna wrap you back
Looks
up.
great, and the rib side looks fantastic. You know, small incision, 2 centimeter incision for both of you.
Really?
Yes. Okay, let me just take a little peekaboo, actually. No, I did. Your tip was extremely difficult. I know this hurts. I know.
Carissa, have you been drinking alcohol?
I'll drink more after this.
You been drinking?
No.
What have you been drinking?
I actually haven't had any alcohol.
Wine with the Percocet?
Yeah.
Kill me.
Do you understand that you could actually take those 2 Percocets and wine, because they're both depressants, and you could not wake up?
You guys are giving me an anxiety attack because I did.
Wait, are you drinking alcohol also?
Of course I did.
Okay, you guys are not going to do that.
Okay, so
Please,
the dryness.
You're worried about dryness, we're worried about you dying. Mixing alcohol and narcotics can render you unconscious, stop your breathing, and basically you're found dead in bed. Okay, look us in the eye. No more drinking.
I'm fine.
No, that's not what he asked. Not if you're fine.
Yeah.
Look at us and look at me right now and say you're not going to drink anymore and you're not going to take 3 Percocets.
She understands this. She's not illiterate, okay? She knows.
But no, you don't know.
She does
because
know.
you wouldn't have done it then.
She does know.
I don't appreciate Christina. Tell me, okay, she got it, stop it. No.
If you have a problem, we have a problem.
No.
So
Yeah, I know.
we don't want to have a problem.
Hello.
Hi. I'm all bruised up.
How are you feeling?
Not alright.
Oh, I'm sorry to hear that.
It's been a week since our surgery, and we have not been able to go to the gym. We've been in bed. We've been on high sedation. Hi.
Lovely ladies.
Hi.
How are you? Last time the twins were here, Dr. Dubrow and I found out that they were drinking alcohol and taking an excessive amount of prescribed pain medication.
We didn't take any pain medication today. Yeah.
But you stopped the drinking, right?
Yes.
Great. I made it very clear to them that we were concerned and they had to take the recovery process seriously. Okay, now this next thing is gonna feel kind of weird. Come on up. There we go.
It's out, my sweetie.
What the hell was that?
It's kind of like a
Looks like
monster.
a fish. Oh.
Okay, now,
Breathe better
do me a
now.
favor now. Breathe through your nose.
Just breathe. Oh my God.
Is that better?
I've never been able to breathe that good in my life, ever.
I love hearing that, girl, and this is
my
only
God.
beginning.
I feel like I'm a little smarter. I honestly do feel like that percentage of my brain has went up since the oxygen is hit.
It's coming up, madam.
Oh, it feels so weird.
Yeah, so your nose is gonna be swollen when we're done with them.
Look great, Carissa.
Actually, it looks a lot better than I thought.
Wow. Really? That's
Oh
so crazy.
my God. Give me mirror, please. Mirror on the wall. And look, your nose for your first week.
Oh, wow. No my goodness. This looks so good.
Okay,
Cool.
that's it.
Oh my God.
Let's switch. You guys switch seats.
Does it look better than it did before, though? Yeah, it looks a lot better than it did before.
Hey, by the way, young lady,
Yeah.
you owe me an apology.
Oh, yeah.
You snapped at me inappropriately the other day.
I
You're not gonna drink anymore, and you're not gonna take 3 Percocets
did. She
anymore.
understands this. She's not illiterate, okay? She knows.
But no, you don't know
She does
because you
know.
wouldn't have done it then.
She does know. Say sorry, Christina, but you meant it. No, I'm really sorry. Her
that'd be
tip
fun.
looks amazing.
Yeah.
That's insane.
I never want to lose a patient, especially if it's something that can be prevented. The lady seems sober, which is the best thing that I could have asked for. You ready?
Yes.
Remember, this is 1 week. Mirror,
You're
mirror,
gonna
mirror
love.
on the wall. Ready? On your mark, get set, go.
Holy Don't you love it? I love it. Oh God, we look more alike. Oh, it's so cute. Some of the things we've learned after having surgery with Dr. Nassif and Dr. Dubrow is we have to be better recovery patients.
We were trying our best to be good patients, but we were failures.
We don't want to ourselves up again. We went through like a graduation process with them, and now we're done with surgery and we're focused on our careers, and that's the most important thing in our lives.
We're gonna make you proud. We're gonna come in here with good
Gentle group
feelings.
hug. I don't want to get you guys.
Our noses.
He seemed a lot sweeter without the Dubrow. And he actually gave us a hug. That dirty bit.
A little dirty bit.
But we knew he had it in him.
Yeah.
He just wanted us to himself.
Today's really important to us because it's our first photo shoot since we've had our noses and our boobs fixed. Shooting with Raquel, she's one of the best photographers in LA. The photos we did with her over a year ago, she had to do a lot of editing and we were very self-conscious. So shooting with her today is going to be easier on her this time. Since having our surgery, we both can breathe better. Oh yeah, it's amazing in our boobs. There's no scarring whatsoever. Like Dr. Dubrow is a magician.
Your nose was so f***ed up before then.
It was.
No.
It was.
No, but I will tell you this. You want to know as a trip? With the same hair and makeup, I can't tell you guys apart now.
We wanted the doctors to make us look alike again and more natural, and we never thought that we were going to come out looking like this. I mean, they nailed it.
Guys,
How's
you
it
guys,
going?
it's going good. You guys look beautiful.
Thank you.
We're good.
All right,
Yeah.
I'll be out there. You guys have like 5 minutes?
Okay, perfect.
Yeah.
All righty.
Thank
Love
you, Lacey. Love you. In this moment, it's everything for us. We're hyped. We're excited. We just are ready to take everything off, show everybody what we've got, and be proud of it, and be secure and be happy. Honestly, we haven't felt this comfortable in our own skin since we were 18.
Let's see you.
Okay, so who's who?
Okay, oh my gosh, you guys look amazing. Okay, I gotta see it. I'm ready. Ow! Whoa!
You guys look gorgeous.
Amazing.
Before surgery, we looked like two botched betches. And now, after surgery with Dr. Nassif and Dr. Dubrow, we're the perfect 10 twins we were meant to be. Exactly.
Oh, phenomenal. And I love the hair to the side. That looks so good. Maybe even kind of like one, yes, one down, one up. Perfect. Wow, you guys look amazing.
Now that we're done with surgery, the most important thing in our lives is our careers. We look normal, we're not botched, we feel comfortable, and we're ready to take the rest of the city by storm and finish out the rest of this year. Yeah, watch out, bitches, because it's on, whores. The twins are coming for you.